Hello, this is Paul Chek. Welcome back to my final presentation in Tips on Breathing, number 6, boobs, bras, and breathing. I was going to end this series on number 5, but then it dawned on me there's something very, very important that people seldom learn about, that they need to know about, because the issues I'm going to share today are connected to pain for a lot of women, especially if they're athletic, but even if they're not athletic, this is a worldwide problem wherever women wear bras. So we're going to start off with number 1 in the title, boobs, then we'll go to number 2, bras, and we'll tie those both into breathing. When a woman has big boobs, and women's boobs can get big, I had a patient many years ago who had been bounced around from doctor to doctor on workman's compensation, and she worked in a research laboratory at the Salk Institute, and she was changing the trays. She was caring for all the research animals, and she had very, very big boobs, probably some of the biggest boobs I've ever seen on a woman, and she had very severe chronic neck problems and what is called thoracic outlet syndrome, which is this area right here where the nerves come out of the neck, pass through the scalene, the anterior scalene's there, the medial scalene's there, that makes the thoracic outlet. The nerves go down under the clavicle through the armpit and down into the arm. So she had a lot of tingling and numbness in her little finger and ring finger, and weakness in the hands, and circulatory problems, and headaches. And headaches are one of the most common features of thoracic outlet syndrome, and they're often misdiagnosed. I was doing workman's compensation work for her, and I asked her if she would mind if we actually weighed her breast, because I wanted to see how much weight this girl had to hold up. She was only about 5'4" as well. And I think her boobs each weighed around 12 or more pounds, if I remember right. Very heavy. Now, why that's important to understand is that women are often not aware of the load that the weight of their boobs can put on their rib cage, or the weight of their hair. I've had women with chronic neck problems that had long, heavy hair, and especially when it's wet. And depending on how a woman wears her hair, that can actually exacerbate neck problems for this simple reason. Most people are unaware of a concept called light elastic forces. When a dentist or an orthodontist makes braces to move your teeth, they actually only need to use 1/2 of 1 gram, which is a tiny amount of weight, to move a tooth, as long as that pressure is sustained over time. So when we have a case where a woman has heavy boobs, then she has a lot of weight creating, which compared to a gram isn't light, but elastic forces pushing the chest down under the influence of gravity. And if a woman that has, big boobs, whatever you want to consider that to be, then what happens is if they do a lot of abdominal work and they start doing a lot of crunches and planking and things that activate the outer unit muscles, the rectus abdominis and the external obliques in particular in this instance, then it has the effect of progressively pulling the rib cage downward toward the pubic bone. So all you got to do is flex your abs and you'll see it'll pull your chest down. So if you've got that load, then these tight abdominal muscles transfer that load right up through into the scalene muscles, which are some of the key breathing muscles, along with the external intercostal muscles, which help open the rib cage. So all the tension, if you just think of the abdominals as a giant spring, just transfers right up into the neck. And as the tension gets higher, it pulls the anterior and medial scalene tighter, closer together, strangling the thoracic outlet. Now, there's not just nerves running through there. There's blood vessels, and there's veins, and there's lymphatic vessels. So it's a very busy area. So the key point that I want to make is that when a woman has decent-sized boobs, if she wants to maintain optimal breathing function and not be in a lot of pain and have headaches and all sorts of soft tissue dysfunction, it's very wise to shy away from any kind of isolation training for the abdominals unless it is corrective exercise, such as the kind of exercises I show in my book, How to Eat, Move, and Be Healthy, in my book, The Golf Biomechanics Manual, in our Tennis Biomechanics Manual by Lee Brandon and myself, and then for more comprehensive investigation, scientific core conditioning, the correspondence course, where we show you a fairly detailed assessment methodology and progression methodology. But once the inner unit muscles, the pelvic floor, the transverse abdominis, the posterior fibers of the internal oblique, and the diaphragm are working properly together, isolation training has to be used very, very carefully because it has this wind-up effect on the body. So what I had to do with this girl and many others is I had to do a lot of soft tissue work and stretching and mobilizing to free up the abdominals, free up the chest muscles, especially the pectoralis minor, and free up the hip flexors if they're tight, because those all pull you down and forward into a pronated position, which is the position of exhalation, and can lock you in that position. And that tension in the front of the body then overloads the muscles in the back of the body that are responsible for counterbalancing the flexor muscles to keep your posture up and your eyes, ears, and teeth level with the horizon. So the secret is make sure your abdominal wall is working correctly. And often one of the key things that's driving faulty abdominal wall function is dietary problems, such as anything that inflames the intestinal tract or the digestive system. And then the inclusion of pulling exercises, or the kinds of postural exercises that I show in my book, How to Eat, Move, and Be Healthy, and my Golf Biomechanics Manual, and that you learn in Chek Exercise Coach and more advanced training programs through the Chek Institute. And all you got to do is just look at a person's posture, or if you're a woman, look at your own posture, or have someone look at it for you. It's best to have them take a picture of you from the side, and if your cheekbone is not directly over your collarbone, and your collarbone should be directly over your pubic symphysis. So if you hung an imaginary plumb line from your cheekbone, it should go right through your collarbone and your pubic symphysis. And that would mean you have optimal vertical alignment, and that indicates that you have muscle balance in the body, which is very critical. So if the boobs are heavy or the abdominals are tight, either or, then that loads up the flexor chain, which puts tremendous load, and now your whole rib cage is hanging off your little scalene muscles. There's an anterior, medial, and a posterior, and in most people they're not much thicker than your little finger, if that, and they work 24 hours a day to breathe. The average person breathes 25,900 times a day. So if you can imagine putting a couple of cantaloupes up here and lifting them 25,900 times, and then visualizing these tiny little muscles working against the pull of great big muscles like the hip flexors and the abdominal muscles, then it starts to become more realistic, and you can start seeing how muscles develop trigger points, fibrous tissue, scar tissue, and then there's all sorts of biomechanical abnormalities that I won't go into because of the complexity of it. Now, the next thing is bras. If a woman takes her bra off and turns around in front of a mirror, and she can actually see an imprint from where the bra was, in my experience of treating countless numbers of these types of patients, the bra is tight enough to disrupt the expansion of the rib cage. When you have a bra on, you've got an elastic force wrapped around the rib cage. So every time you breathe, the external intercostals and the scalene muscles at normal resting breath are the primary muscles of inspiration, and the diaphragm have to actually stretch the bra open because the rib cage has to expand front to back, it has to expand lengthwise, and it has to expand laterally. So there's 3 planes of expansion, but if you grab a hold of that rib cage or wrap it up tight with a bra, then you're actually having to not only work against all the soft tissue stuff we talked about, now you're working against the tension of the bra, and that can just be, what pushes Humpty Dumpty right off the proverbial wall and into the doctor's or the therapist's office And unfortunately, most doctors and therapists will treat the symptoms of these kind of problems and give you all sorts of drugs, and I've even had women have a scalenectomy to have those scalenes cut out because they were not getting relief, and even after the surgery they still had problems, and I was able to clear this stuff very quickly and easily, which can leave a person in a lot of tears because of the thousands of dollars and all the pain of the surgery and all the drugs and all the poking, only to find out that it could easily be addressed through diet, lifestyle, and proper corrective exercise, and the effective use of mobilization, stretching, and the kinds of things we're talking about here. So as a general rule, if you take your bra off and it's leaving a mark on your back, you're wearing it tight enough to overload the scalenes and create soft tissue dysfunction and a breathing pattern disorder. And these tight abdominals, big boobs that are not counterbalanced with proper exercise, stretching, etc., and tight bras all lead to breathing pattern disorders, the most common of which by far is hyperventilation syndromes, or shallow breathing, which is a key trigger for anxiety in the body-mind construct and leads to a lot of mental emotional problems, and often ends up leading to people being put on psychotropic drugs to manage things like anxiety attacks, all of which are relatively unnecessary. Now, many women say, well, I exercise, and if I don't wear my bra tight, my boobs are flying around. Well, I understand that. So the key thing I would point out to you there is, one, when you're exercising with any intensity, you're breathing a lot. So if you wrap those boobs up too tight or put your bra on too tight, you're setting yourself up for more soft tissue dysfunction and breathing pattern disorders. And since a breathing pattern disorder is very, very fundamental to many other muscle imbalance syndromes, because breathing is the chief biological system that the body uses to keep itself alive, so the body will make any compensation it has to keep the breathing mechanism working. So if you're exercising and your boobs are flying around, then it's a very, very careful assessment that you need to do on yourself of just how much tension you need to be comfortable without causing these kinds of problems. And to the degree that you have big boobs and you need to wear your bra tighter, then you need to work on using a foam roller to keep your rib cage mobile, keeping your abdominal muscles, your psoas muscles, your quad muscles, particularly the rectus femoris, and your neck muscles loose. There's a whole system of stretching the neck, the muscles in the body in my book, How to Eat, Move, and Be Healthy. There's 20 stretch tests. And then in my golf biomechanics and tennis biomechanics manual, we have specific stretches for the scalene muscles in there. So the pec minor, scalenes, the abdominal wall, and the hip flexors and quads need to be kept mobile, flexible, and the pulling muscles need to be kept strong, and the rib cage needs to be kept mobile. So rolling on the rib cage, on your back, on your front, and on your side, and keeping the latissimus dorsi muscles from getting too tight is also very important. Although most women don't overdevelop their lats with all the functional exercise craze today, there is plenty doing that. The lats run from the shoulder back here to the pelvis. So if the lats get short and tight, they depress the shoulder girdle, and that loads the scalenes. It actually puts a load on the scalenes and the whole neck complex, which leads to trouble. My final tip is wearing bras that have synthetic material is another insult to the body. Synthetic materials disrupt the flow of your own aura, your own energy field. A simple analogy I give people, if you've ever been to a hockey rink and looked through plexiglass, there's always a problem getting a clear focus versus if you were looking out a clear window like I can look out right here. So when we're wearing synthetic materials, it's actually disruptive to our energy field and leads to another stress factor that is just another parasite on your overall energy levels and is disconnecting you from harmony with the environment. So I always encourage women to find natural fiber bras, whether they be cotton, hemp, or any of the natural fibers that our bras are made of. And many of the women that I've worked with found them quite easily. So in closure then, if you got big boobs, make sure you're not overworking your abdominals and your hip flexors. Make sure you're keeping your flexor muscles loose with proper stretching, and make sure you're using foam rollers to mobilize your rib cage and keep that system healthy. Make sure you're including adequate pulling exercises, and exercises like deadlifting, bent over row, cable rows, and then there's lots of postural exercises like the prone cobra, the supine lateral ball rolled on a Swiss ball, which is in my book, How to Eat, Move, and Be Healthy, and a variety of those types of things. In my video DVD titled Swiss Ball Exercises for Better Abs, Buns, and Backs, there's plenty of postural re-education type exercises in there that can be very helpful to people that may not be athletes but need some kind of supportive corrective exercise. Remember, it only takes a half a gram of sustained pressure to move a tooth, and many times we're dealing with pounds of pressure. I've seen lots of these bra straps that were very tight, and they're getting up into the pounds of pressure. Remember, even 1 pound of pressure multiplied by 25,900 is a lot of work. Now, if you don't wear your bra to get bed, that would be 8 hours less, but it's still a massive number, and it leads to a lot of unnecessary problems. And then I also suggested that you use natural fiber bras because they're more harmonious with the flow of energy and information in your energy field, which is very important because your energy field's constantly giving you information about what's going on outside your body, even at the subconscious level, and broadcasting information about you out to the outer world, whether it be other people or the world or the universe itself, because we can't separate ourselves from the universe. So those are my key tips today to close out our breathing series. These are very, very important tips. If I had $5 for every woman I've had to rehabilitate with one of these problems, and I could put it all in a suitcase, I'd be probably a very rich man, because there's been that many of them. And just with Chek professionals alone, that would be a very large suitcase for all the women they've treated with these problems. And it's unnecessary. You can still look beautiful. You can still feel good. You can still get the support you need as long as you include these maintenance tips and are aware of what you're doing with your exercise program and how your body's working. So thanks for joining me today. I hope you enjoyed my Tips on Breathing series, part 1 through 6, which is concluding now, and I'll look forward to sharing more with you as we move forward with my fun and exciting blogs. See you next time.